Hi everyone, I'm Kim Barnes. Welcome to HealthWise Austin, a new show dedicated to helping you live the best life you can. During the next half hour, we'll introduce you to healthcare specialists making a difference in our community. You'll learn about new procedures and new concepts from some of the best in Central Texas. From innovations in plastic surgery and weight loss surgery to alternative treatments in gynecology and breakthroughs in dentistry, as well as help for children with parents with life-threatening illnesses. This is HealthWise Austin. Here at Hall Plastic Surgery and Rejuvenation Center, the goal is to help people achieve their own natural beauty. Dr. Jeffrey Hall has been practicing plastic surgery in Austin since 1995 and is Chief of Plastic Surgery for Seton Medical Network. Dr. Hall, you're in the business of helping people look and feel better. What is your philosophy?
I'm wanting somebody to look as good as they want to look, but then at the same time look natural. I think sometimes we can get into a scenario where we might be pushing the limit too much, trying to achieve too much, and I think sometimes people can come out of that situation looking like they've had surgery. So I would take the premise that let's look at what things really bother you the most, and then focus in on those things, and then come up with a plan to meet those goals, and do it in such a way that it has harmony or blends in.
Do some of your patients come in thinking they're going to be able to walk out looking like a movie star?
That's sort of our challenge today, is because I think our society gets a lot of press where they see people that look like movie stars, or they are movie stars, so people go, oh, I want to look like that person. And so they'll come into the office and they'll bring pictures and they'll show me, say, a nose. They say, I want my nose to look like this. But then, reality sometimes sets in where we have to look at what their nose is. And that's where, I think education is part of the process in our consultation, where it's important to spend the time in the beginning where we sort of review what the anatomy is and what their anatomy is. And then, okay, this is achievable and this isn't with surgery. So yes, we do have people that come in with that request, but by and large, I think if we can identify their goals, then I think we're going to be more likely to reach their expectations.
How are you different from other plastic surgeons?
We're going to come up with both non-surgical and surgical plans and try to make that fit them, not treat them just like everybody else.
So what are you in for today?
And they get one problem in one surgical procedure. We may need to do this in stages. We may need to add different treatments to get them there. So I think coming up with an individualized plan makes me a little bit different.
How do you decide?
Here's the goals that you're trying to achieve, and here's the trade-offs. Okay, this maybe can give you the most change and the most improvement, but it's going to require the most downtime and the most cost. So again, we can maybe make a different choice, get you an improvement, but maybe not as much cost, not as much recovery. If we just take a person and put them into one category, such as a surgical patient, we may be missing out on getting something that will fit them the best or give them the best result. I think we want to look at, okay, let's say if we're talking about your face. Okay, yes, we want to sort of reshape the face, but if we don't talk about the skin, what does the skin look like? So skin care is important, and then maintaining that. Let's say we did a facelift on a patient and rejuvenated their face, but if their skin looks horrible, then we aren't going to sort of hit the mark. We're just going to get halfway there. So I think part of our consultation is meeting with our whole team, which is an esthetician, even nurses that are aesthetic nurses that can do things like Botox.
I understand that you're not just about plastic surgery and you really want to help people feel their very best. What else do you offer?
We spent some time in my practice developing a plan where we're not just going to look at the outside, we're going to look at the patient as a whole. So maybe we can do things that will make you look better on the outside, but we want you to feel better on the inside. And that's where we try to incorporate things like wellness and fitness. And we have a holistic medicine person in our practice. We have a Pilates instructor that is able to help you sort of go through that fitness part in a more personalized way. It's not like you're just going to be going to the gym and I'm going to do so many sit-ups or so many lifting of weights. She's going to develop a plan for you that's going to be more personalized. You're going to work one-on-one with her. And then there's some testing that we can do that are more specific to those let's say, nutrients or important chemicals in your blood that like vitamins, antioxidants, that we can literally test the level that you have and then focus a supplement plan to correct the ones that you're deficient in. The equation is, we want you to look your best but also feel your best. So looking your best can be surgical versus non-surgical.
What non-surgical options are we talking about?
Some of the skin resurfacing or laser treatments that we have can help with the pigmentation in your skin, the fine lines in your skin, and even some tightening to your skin. Then we also have things like an esthetician, which can help sort of with the maintenance of your skin.
So what does this laser do?
Well, it has a way to resurface skin. It has a way to take care of pigmentation in the skin, and also has a way to tighten the skin. And then we also have, with the same company, a laser that's used for hair removal, which I think is a big advance in what we used to have, in that it's virtually painless. Our philosophy is that with all of this, whether it be the laser treatments, the skin care, or the surgery, that when a person goes into a room, they don't look artificial, they don't look like they've had surgery, they look like they've rejuvenated or refreshed.